Knee pain is a very common problem that affects many people. Often this knee pain affects the patella, also known as the kneecap. It's this small triangular bone you have in front of your knee. We call this problem chondromalacia or patellar chondropathy. Other problems that may be causing this knee pain could osteoarthritis, rupture of the cartilage in your knee joint. It could be a meniscus injury or even a ligament injury. A knee strain and in some cases knee pain can also be caused by the well-known bursitis, and all these causative factors for knee pain can be exacerbated by muscle weakness of the muscles around the knee, of a mobility test. So these factors need to be observed. I am Dr. Kelvin. I work in areas of trauma, orthopedics, and sports physiotherapy. In this video, you will learn 3 exercises, simple and easy, to effectively solve knee pain without surgery at home. And these exercises also help you improve then your strength and your knee mobility. Before showing you these exercises, I'm going to ask you to leave your like, subscribe to the channel. My goal is to reach 100K subscribers. Your subscription, your like, your comment down below help me a lot to achieve this goal. So get to the video. Before discussing the first exercise, I need to discuss with you a very important issue to grasp before, which is knee alignment. We have 3 types of knees: valgus knees, neutral knees, and varus knees. And each of these types of knees can be influencing your pain. If 2 exercises without correcting postural issue, it will worsen the whole problem. The valgus knee, for example, is the knee that turns inward, very common in women. This type of knee often is accompanied by more pronated footstep, a collapsed footstep, more collapsed feet. And valgus knee can be causing compression in the lateral compartment of your knee. So, valgus knees often accompany a pronated footstep and pain on side of knee. We have neutral knee, the one neither valgus nor varus, and this type of knee should be strengthened in these exercises. But even if a person has a neutral knee, accompanied by a footstep that is also neutral, they are not free from experiencing knee pain. So if you have a neutral knee, but your knees still hurt, these exercises are also important for you. And another type of knee, just like the valgus knee, which I understood, this one sharing now, is a postural deviation. This other type of knee, the third type, is the varus knee, the knee that points outward, more common in older men, soccer players, for example. Romario is example. So we have this third type of knee, postural deviation, and this one, generally most of the time, is accompanied by a footstep that points outward, one more supinated step, one more open step, and also accompanies one pain in the medial compartment of the knee. So the varus knee overloads the middle part, the inside part of your knee. And I'm curious to read your comment. Comment down below for me. What type of knee you think you have? If it's that more valgus knee, more inward. If you think your knee is neutral, or if it's that more varus knee, more outward. I'm curious to read your comment. Find someone with a knee similar to yours, and give a like to that person's comment. And the pain I mentioned to you, knee valgus, pain in lateral compartment, outside part of the knee, varus knee, pain in medial compartment, on the inside part. These postural deviations in the knee, when they accompany a person for a long time, while they walk, while they do physical activity, while they perform daily activities, this postural deviation, it takes the patella off the track axis. Let's call it a track there on the femur, which thigh bone. This patella, it travels along a track while you move, while you extend and flex the knee. And if you have this postural deviation, while walking, while running, while doing a squat exercise, this patella, when it goes off its axis, it starts to wear down. softening the cartilage. And then we have, as I mentioned before, patellar chondromalacia, which also causes this knee pain. And now that you have understood necessary information about knee alignment, let's move to tasks. And the first exercise involves squatting. At home, you can sit on a chair and use another for support. You need to ensure that this chair won't slip. You have to make sure that you won't fall. You can sit with a chair in front of a window. You can sit on your couch and rest your hands somewhere. This is the first exercise, and you already know about the alignment of your knees. You need to keep your knees aligned. Otherwise, you might feel pain in your knee. While performing this exercise, how do you align your knees? So the first thing you need to do is form a base. Imagine a line that goes from your shoulders to your feet, and this line needs to be straight. It cannot be tilted. So draw a line from your shoulders to your feet. Form a base with your feet that is aligned with your shoulder, and then the knees need to be within this alignment that you drew from your shoulders to your feet. And when you squat, when you do the squat, when you sit and stand up, you cannot lose this alignment. The knee cannot go out of the line you drew from shoulders feet. And now you're asking me, what is the frequency that you need to do these exercises? That I will show you video. You should do it every other day, every day, every other day, every other day, to gain strength, mobility, and improve your knee pain. For this squat exercise, you can do 3 sets of 10 repetitions. Each day you do it. Another question you might be asking yourself, I'll give you the answer right away. If I have pain doing this exercise, what should I do, doctor? If you have knee pain doing this exercise, try to reduce the range of motion. Try not to lower it that much. Try to lower it to a limit where you don't feel pain. The popping sound is allowed in this exercise, but very strong pain is not allowed. If you feel very strong pain, stop this exercise and do the next ones. And I'm going to give you another golden tip. Leave your like for the tips I'm giving you, and subscribe to channel, because tips are golden for you to do these exercises, improving your knee pain. Another tip is that when you squat, you must not let your knees go past your feet line. What I mean by this is you look down at your feet. When you're squatting, you need to see at least a quarter of your feet. You need to see at least the tip of your feet. If you can't see the tip of your feet, if you go beyond this limit, then you might be putting too much strain on your knee. This can worsen your knee pain. The muscle mass around the knee helps you absorb impact, for example, so it's quite beneficial for those who have knee pain. It also works on your knee mobility. As you move your knee, it helps lubricate your knee joint. The movement releases fluid inside the joint, which we call synovial fluid. This synovial fluid helps to nourish and lubricate knee. That's why in most cases, exercising helps to cause almost instant pain relief. Because this aspect that I mentioned, synovial fluid. Let's move on to the second exercise. The second exercise involves patellar mobilization, such as, that's right, you will start to mobilize your patella with your hands. So, the first thing you can do for this exercise is to sit down and stretch out your legs. That's right, you will stretch out your legs, because then you can better mobilize your patella, your kneecap, and improve your knee pain. Now with your legs stretched out, you will make a pinching motion. Bring your 2 thumbs together, and you will first carefully position your thumbs on the top part, here on the upper edge, on the top and outside of the knee, as you can see here in the video. And then you will simply press down. Press diagonally. So this is an exercise for patella mobilization. See that I'm playing here with my patella over the cartilage. And then you can simply do this patella mobilization. You can easily count to 10, 15 times. Then you come here still on the upper edge of the patella, in the medial region, in the middle region, and now push in the opposite direction, downward, diagonally, downward, and outward. So you can also do 10 to 15 repetitions. You can also do it here, on the top part. Place one thumb over the other. Now very slowly push from top to bottom. From top to bottom. Many people have what's called a high patella. That is, the patella is higher than it should be here. You are pushing, doing this exercise to push your patella downward. And this also helps a lot to improve your knee pain. You can also do it to the side, so place both fingers on the inside of the knee. Push your kneecap outward as well. 10 to 15 repetitions and you will notice that you're playing around with your kneecap. It's helping to lubricate the knee. And this is also another exercise that helps to provide almost instant relief for your knee pain. Now we are going to the third exercise. And for this third exercise, you will need either a towel, or a rope, or a belt. You will need something to hold your foot up, as you will do a stretch, lying down for the posterior muscles of your legs, of your lower limbs, especially for the hamstring muscles. We call these muscles the hamstrings. We will also stretch the triceps surae, the calf muscles of the calf, of the leg, are part of the posterior chain, the posterior myofascial chain, as you can see in this image. And when this chain is shortened, it can be a major culprit for your knee pain. These muscles that we are going to stretch, they shorten. For example, when a person spends a lot of time sitting, but those who also work standing, those who spend much time standing, can also suffer from knee pain and shortening of these muscles that we are going to stretch now. So you can lie down to do this stretch. Look, I'm demonstrating it in the video. And then you will hook your belt, your towel, your rope, or whatever you have available at home. You will hook it onto your feet. And now you will slowly pull your leg up, with the knee straight, with the heels towards the ceiling, trying to bring the tip of your foot down towards yourself, making a dorsiflexion movement. And then you will gain range of motion. It's normal to feel a slight stretching pain in the back of the leg, in the calf. What shouldn't happen is pain behind the knee. And then you asked me, how long should I do this stretch? And I have this answer in all my videos, where I cover the topic of stretching. The minimum time to stretch the muscle is 40 seconds. This thing of doing a 10-second stretch, as I often see in the gym, doesn't work. People are just wasting time there. You won't stretch that. The minimum time to stretch the muscle is 40 seconds. You can do this stretch then for 40 seconds. In the second week you increase to 60 seconds. Then you increase to 80. That you will be able to greatly improve your knee mobility by stretching this posterior muscle group. So do these exercises to improve your knee pain. And let me know in the comments if these exercises helped you. Your comment is very important to me. I read them all. Believe me, I read all the comments on my videos with great care, and some comments can even become a video, as is the case with these comments you're seeing here, that inspired this video I'm recording about knee pain. Don't forget to send this video to someone who also has knee pain. You can help this person. Let's spread this chain of good in WhatsApp groups, Facebook groups, this video that will help people like you. And I'm leaving another video here for you to watch after this one, with plenty of information, content, and quality about knee pain. It's important for you to watch this video too. And this one here. This one here, YouTube will suggest to you, so I don't know which video will be here. But this one, YouTube will suggest to you from this channel. Thank you very much to you who made it to the end of this video.